On behalf of my colleagues, I will present the results of a part of the PEACE-1 study. PEACE-1 study is a randomized phase 3 trial which enrolled patients with de novo metastatic castration-sensitive prostate cancer. And patients were randomized between standard of care, which was firstly androgen deprivation therapy, and after 2015 it was androgen deprivation therapy and Docetaxel. And the question was, is interesting to add Abiraterone and Prednisone to the standard of care, and or radiotherapy, local radiotherapy for prostate cancer. More than 1,000 patients were enrolled in this study, and the results have been already presented by Karim Fizazi at ESMO and ASCO concerning the benefit of the triplet association for overall survival against standard of care. And today at the ESMO meeting, I will present the 8 months PSA decline. It is a surrogate for radiological progression-free survival and overall survival in the PEACE-1 phase 3 trial. And we looked at a cutoff PSA of 0.2 at 8 months. And the follow-up of this study is 4.4 years. And we have to, for the following analysis, we have to require the PSA at 8 months. And 79% of the patients included in the PEACE-1 trials were analyses were available for the PSA at 8 months. And we observed that radiological progression-free survival was higher for patients who had a PSA lower or equal to 0.2 at 8 months. For standard of care, which was castration with or without Docetaxel, or for the standard of care with Abiraterone and Prednisone. And the median survival was also increased for patients with a PSA lower or equal to 0.2 at 8 months. And we observe higher percentage of patients who reach a PSA lower or equal to 0.2 at 8 months with the standard of care with Abiraterone and Prednisone. And when we looked at the populations who received as the standard of care castration plus Docetaxel, we observe higher median survival for patients who get a PSA lower or equal to 0.2. And with the triplet association with androgen deprivation therapy, Docetaxel, and Abiraterone Prednisone, 51% of patients had a PSA lower or equal to 0.2 at 8 months, versus only 25% with androgen deprivation therapy plus Docetaxel. And after we looked at the threshold of PSA at 8 months, and we observed that less patients had PSA above 4 at 8 months with the triplet association with androgen deprivation therapy, Docetaxel, and Abiraterone Prednisone. But whatever the treatment, the median survival was very low. So, with this analysis, we demonstrated that the PSA cutoff of 0.2 at 8 months is a good surrogate for radiological progression-free survival and overall survival for the patients included in the PEACE-1 phase 3 trial. More patients with the combination of androgen deprivation therapy, Docetaxel, and Abiraterone Prednisone get a PSA lower or equal to 0.2 at 8 months versus androgen deprivation therapy and Docetaxel. And we probably need to do more treatment for patients with unfavorable PSA decline at 8 months. And for patients with a high PSA level at 8 months, we need to look at clinical and molecular characteristics for those patients. So it's very interesting information in this population to get some more treatment for some patients.